So, an outline of what I'm talking about today. I'm going to start with some key childhood vaccination coverage trends, then talk about the National Vaccination Insights Project, which includes national surveys of barriers to childhood vaccination and development of evidence-based strategies to address those barriers. Very briefly, mention the National Immunisation Strategy, which David has already talked about, and then conclude with some reasons to be hopeful about getting back to 95% coverage and some challenges. So, coverage trends. So NCRS has published comprehensive annual immunisation coverage reports for almost 2 decades now. So this is a figure from our 2020 coverage report, looking at trends in fully vaccinated coverage by quarter for the decade up to 2020 at the 3 standard age assessment milestones, so 12 months in blue, 24 months in green and 60 months in red. And some key points to keep in mind when interpreting these sort of figures. There's about a 1-year lag in terms of assessment of fully vaccinated coverage. So that means that coverage assessed in 2020 represents primarily vaccinations due in 2019, i.e. before the COVID pandemic. Also important to note that changes to how we measure fully vaccinated coverage can have major impacts. So in lost my arrow, but in 2014 there was a major change to the assessment algorithm for coverage at 24 months of age. So there was added in the second dose of measles, mumps, rubella, the first dose of varicella and the first dose of meningococcal C containing vaccine. And so you can see that before 2014, coverage at 24 months of age was tracking along above the other assessment milestones, whereas when the algorithm changed, it dropped substantially and has been lower ever since. And around the same time, the national targets for childhood immunisation coverage were increased from 90 to 95%. And I did have an arrow, which I can't see here. No. So you can see that the coverage has generally steadily increased from 2015 to 2020 across all 3 age milestones. And that's likely contributed to by a range of factors, including state, territory and federal government initiatives, including No Jab, No Pay, which has been mentioned, and don't have time to go into details about that, but do refer people to, there's my things coming in out of sequence. Do refer people who are interested in No Jab, No Pay and its impact to our paper published last year in Lancet Western Pacific. Then this is a figure showing trends in fully vaccinated coverage by year as opposed to quarter in the last slide, from 2020 to 2024 at the 3 age milestones. And can see that in 2020, which remember represents vaccinations due in 2019 before the pandemic, fully vaccinated coverage at 12 months and 5 years of age peaked at 94.8%, so very close to that 95% target. But then it's been drifting down year on year ever since. Also important to note that we tend to generally focus on fully vaccinated coverage at these standard milestone ages. However, coverage of some vaccines and antigens is actually still over 95% if you assess it at 60 months of age. So this is a table adapted from our 2024 coverage report. And on the left-hand column, you have the vaccine antigen, middle, the dose assessed, and on the right, 2024 coverage at 60 months of age. And so you can see that for the majority of those vaccines and antigens, coverage was over 95% and over 96% for the third dose of Hep B, second dose of measles, mumps, rubella, and first dose of varicella. So that indicates that catch-up vaccination is occurring, which is good. I mean, obviously, ideally, we would prefer to have high coverage of timely vaccination. Then moving on to the National Vaccination Insights Project. So this is predominantly funded by the Commonwealth Department of Health, Disability and Ageing under NCIA's funding agreement, and it's a collaboration between MCRI, NCRS and University of Sydney. So the intent of this project is routine serial collection of systematic data and insights on vaccination barriers, and this is critical to understand the reasons for why coverage is declining and inform strategies to address those trends. So methods include nationally representative surveys using validated tools, in-depth qualitative interviews and stakeholder workshops to look at barriers and strategies. So the inaugural survey 2024 was 2,000 parents with children under 5 years of age, data collected via an online survey platform and measuring 15 barriers to vaccination with the Australian Developed and Validated Vaccine Barriers Assessment Tool, or VBAT. And late last year, the survey was repeated. The findings of that will be released in the next week or two, so I can't present them to you today, but I will mention some key trends as I go through. So what barriers does the VBAT measure? So you've heard talk about access barriers, so that's practical barriers like difficulty getting appointments and cost that impede parents vaccinating their children when they're otherwise willing to vaccinate them. And then acceptance barriers, which are concerns and beliefs that reduce people's willingness to vaccinate their children and confidence in vaccinating. And so you break those down into thinking and feeling barriers, which include beliefs that vaccines are not safe or effective, and social influence barriers, such as where friends and family don't support vaccination. So this is a figure from the 2024 survey report, which is available on the NCRS website. And this shows the prevalence of barriers reported by parents, colour-coded, so access barriers in blue, and thinking, feeling barriers in yellow, social influence barriers in green. So you can see that by far the most reported barrier was feeling distressed when thinking about vaccinating their child at 60%, followed by can't afford costs and not easy to get an appointment. And this is a figure from the same report showing the percentage of parents of partially vaccinated children who reported vaccination barriers compared to parents of up-to-date children, with significantly different barriers shown with an orange box around the confidence intervals. So you can see here that there's a mix of access and acceptance barriers, but notably the feeling distressed about vaccinating, which is the most commonly reported barrier, is right down the bottom, so not significant in terms of actual vaccination outcomes. And in our 2025 survey, I can tell you that in this group of parents of partially vaccinated children, the access barriers had remained fairly stable. However, the acceptance barriers had increased substantially in prevalence, and in particular, the beliefs that vaccines are not safe and not trusting information about vaccines. And then this is a similar figure, but for percentage of parents of unvaccinated children reporting barriers compared to parents of up-to-date children, again from the 2024 survey, and can see that the significantly different barriers are much more predominantly acceptance barriers, and that they are much more marked prevalence compared to parents of up-to-date children. And the 2025 survey, again, most of these acceptance barriers were greater, reported at higher level in parents of this group, parents of unvaccinated children. So moving on to evidence-based strategies to address vaccination barriers. So there is formatting's gone a bit wonky on this one as well. There's a wide range of evidence-based interventions to address, improve vaccination uptake. So we've already talked about some of these. So the longest list in terms of addressing access barriers, so reducing out-of-pocket costs, improving service quality, parental reminders and recalls, on-site vaccination outside the clinic setting, default appointments and centres, immunisation information systems like our Australian Immunisation Register, provider performance assessment and feedback, provider reminders and standing orders. Then in terms of thinking, feeling barriers, we've heard a fair bit of talk about campaigns to inform or educate the public, dialogue-based interventions, so that includes the sharing knowledge about immunisation or SKY platform that we've talked about, and school and work requirements or mandates, which have also been mentioned. In terms of social influence barriers, the interventions for which there's solid evidence of effectiveness, community engagement, positive social norm messages, vaccine champions, and lastly, but not least, recommendations to vaccinate from health workers, which have been shown to be effective in many, many studies over the years. So the National Vaccination Insights Project team worked on identifying and prioritising some of these strategies in the Australian context. So started by mapping those evidence-based strategies to barriers identified in the national survey, then holding a workshop with key stakeholders, including jurisdictional immunisation program managers and immunisation provider representatives, to prioritise barriers and strategies to address them, and discuss likely implementation issues. Then the project team situated all this within the evidence base and aligned with the National Immunisation Strategy, and came up with these 4 priority areas shown in this infographic on the right. So making our vaccination services more affordable, easy to access and use, supporting parents, supporting conversations with parents about vaccination, increasing community understanding and confidence, and improving stakeholders' access to quality real-time coverage data. So anyone who is interested in more detail on that and some of the specific recommendations, I refer them to the paper listed there at the bottom, which we published in ANZ JPH last year. So, National Immunisation Strategy, David's already gone through this. Essentially, this is a high-quality, comprehensive strategy. David's also talked about the implementation plan. Essentially, at the moment, we've got an implementation framework and a well-fleshed-out Commonwealth Action Plan with placeholders for monitoring and evaluation framework and links to jurisdictional action plans. And as David said, the full plan will be published later this year, and there's proposals for consideration in the budget cycle, hopefully also in states and territories. So conclusions. So reasons to be hopeful that we can get back to 95% childhood vaccination coverage. There's an extensive evidence base for what works to increase vaccination. We've got a great high-quality strategy and apparent government commitment to implementing it and monitoring and evaluating it. We've got this whiz-bang new CDC. Current fully vaccinated coverage isn't that bad, so it's still mostly over 90%. And for some vaccines and antigens, coverage is actually already over 95% with two-dose measles coverage at 60 months of age, over 96%, acknowledging the issues with timeliness of vaccination. Challenges, so as I said, 2025 survey shows that acceptance barriers are increasing in prevalence, and after many of the talks today, you're probably not surprised. So the after effects of the pandemic and polarisation and the more recent, quite radical US policy changes. So we have this comprehensive national strategy, but it needs to be adequately funded and effectively implemented across multiple initiatives, multiple levels. And at this stage, I'd have to say that there is some uncertainty about the likely adequacy of funding. So we've heard the budget's tight and uncertainty about how bold the follow-through from this excellent strategy will be. Certainly, we need rigorous, nationally coordinated approach to monitoring and evaluation to make sure that the interventions are effective and that there's equitable outcomes. And while the CDC is offering many opportunities, it is in very early days. There's still some questions about its role versus the department, and there's some outstanding tenders still for technical support to both the CDC and the department in terms of provision of immunisation services.